5,000 or more known cases, with many, many thousands more than that that have yet to be diagnosed. Since I announced Washington's stay home, stay healthy order for the state, we have seen social distancing and other compliance measures from our businesses, from our churches, from our families, from people across the state of Washington who are really pitching in to keep us all healthy. It's been very gratifying to see the vast majority of Washingtonians voluntarily comply with this order. So we have a very strong and robust team across the state of Washington, and this team is dedicated to beating the COVID-19 virus. And today we'd like to talk about the ability and need to grow that team and recruit new members to that team against the COVID-19 virus, because if we're going to beat it, all of us have to be engaged. All of us have to be leaders, because the more people that are leaders, the less people who are going to be victims. And so that's why we're here today. Unfortunately, we've had thousands of calls coming in from many places in the state, also to our state and local agencies, from concerned residents, with reports that some individuals and some businesses are not complying with this order. And these people who are calling us are very concerned about their health and the health of others, and how the actions of folks who aren't on the team are putting so many people at risk. My office and state agencies have worked day and night to try to give as much guidance as humanly possible to individuals and businesses about how to comply with this order. And now, working with state and regulatory agencies, prosecutors, and law enforcement, we are providing clear guidance on how to report violations of this order of compliance so that everyone can help everyone be on this team. And that's why I'm pleased today to be joined by Attorney General Bob Ferguson, Chief John Batiste, the Washington State Patrol, Bellevue Police Chief Steve Milet, and Spokane Police Chief Craig Meidel. Together, we are announcing today how these orders will be enforced and how individual Washingtonians can help. Now, our focus remains on educating the public while these orders remain in effect. And we don't know how long that's going to be. And I've previously said that these orders might have to be extended, and that certainly remains the case given the continued growth of this virus in our state. So the essentials of this guidance we're talking about today might be thought of in three tiers. The first tier: if state or local authorities receive a complaint from a citizen, they're going to let people know that if they are violating the order, they really need to stop violating the order and comply with what is healthy for everyone in Washington. The second tier: if they don't come into compliance, the state is going to take action, starting with citations, suspension notices of a variety of permits, including revoking business licenses if that's what's necessary to bring these folks into compliance. The third tier: if that is still not enough, but local and state authorities are going to refer these complaints to the Attorney General for law enforcement, either for civil or criminal charges. We know that violating orders can amount to a gross misdemeanor, but taking the people to court is the very last thing that will be considered and should not be necessary under any conditions for folks who really value the health of their loved ones and respect for everyone in our community. So if you believe a business is violating this order, we have a one-stop online form to submit your complaint so we can investigate it. And that's at coronavirus.wa, that's wa.gov, G-O-V, coronavirus.wa.gov. So if you see gatherings that are in violation of this order, we'd like you to use your best judgment and decide whether to notify local law enforcement or this site that we've set up. And you should find the direct line to your police department. Please do not call 911, that's for emergencies, unless there's an immediate threat to safety. And I do like to stress this: these are local decisions, and we're not going to tell local law enforcement how to do their jobs. We think the best way to help is to provide information and let the local law enforcement agencies make their decision. And I want to thank local leaders around the state for stepping up to the threat this virus poses. The emergency responders, the police and fire who do not fear going in to help people in unknown situations, we know they're heroes every day, as are our nurses and physicians and ambulance drivers. These folks deserve our help, and our help is to not violate this order. You know, we have people risking their health going into these hospitals today to treat people with COVID. And if they can do that, the least we can do is to follow the law of the state of Washington in this order to preserve human life of our neighbors and our families. A regularly updated information for businesses and individuals about our Stay Home, Stay Healthy order can be found again at coronavirus.wa.gov. So I'm now going to turn it over to Bob Ferguson, who's done such a fantastic job for the state of Washington.
Thank you so much, Governor, and thanks to you and your team, who I know are working so hard on behalf of all Washingtonians to keep everybody safe. It's an honor to be here today just to reinforce a few of the key points that the Governor made and the role of the Office of Attorney General working with local law enforcement on this really important issue. Look, we're all in this together, and my office is working closely with state agencies and local law enforcement to ensure that the Governor's emergency proclamation and orders are followed. Our goal is 100% voluntary compliance. We want to be very clear. I don't want to have to use the powers of my office to hold accountable those who intentionally violate the Governor's emergency orders. But I want to be very clear. If necessary, I will. The reason is simple. Lives literally depend upon it. A couple points I want to add on that. A non-essential business that refuses to close, even after, as the Governor mentioned, even after a warning letter, that first step, is endangering public health and committing an unfair labor practice and violating our Consumer Protection Act's prohibition on unfair business practices. We ask you to think about our healthcare professionals who are risking their lives every day on our behalves and the high-risk individuals in our communities. We really appreciate everybody enforcing these orders so we do not have to use those enforcement powers. I do want to add one specific point around something we've received a number of complaints about very specifically, and that is the Governor's March 18th emergency 30-day moratorium on evictions. During this emergency, of course, it is critically important that Washingtonians maintain safe and stable housing. My office has received complaints that landlords are attempting to evict tenants in violation of the Governor's moratorium. We have, to be specific, received reports that landlords are getting creative in trying to work around that moratorium. We take these allegations very seriously. If a Washingtonian feels that is happening to them, please contact my office. We understand these are tough times for everybody, including landlords. However, putting families on the street during this public health emergency is not right and is certainly not healthy for everyone concerned. We appreciate everybody's compliance, and I really appreciate the hard work of local law enforcement folks, some who are on the call, who are really helping on this as well. Next, I want to introduce Chief Batiste of the State Troopers, who's been a true partner and also is going through a tough time as an agency. They lost one of their own recently, and Chief, just really appreciate your service and those of all those who work with you. Thanks so much.
Folks, we're all in this together. Governor, I want to thank you for all that you're doing to help keep us safe. On behalf of all of law enforcement across this great state of ours, I want to thank the folks who are fully complying with the Governor's order to stay at home, stay healthy. We really need your help. For the folks who are out of compliance, we need you to listen to my voice and those of my peers and become compliant. It's in the best interest of you, your loved ones, that you stay at home and you stay healthy and fully comply with this order. Lives are at stake. In our toolkit, if we fail to gain compliance, we'll be forced to use those tools. There are regulatory means that are available to us to deal with folks who are out of compliance. Citations can be used, and as a last resort, we can arrest people. That's the last thing we want to do. We really need you to help us help you stay safe so that we can keep our loved ones healthy and keep you healthy. So please, do the right thing. What's the right thing? Stay at home, stay healthy, and comply with this order. Thank you very much. I'll invite my friends from Bellevue Police, Spokane Police to have remarks or be available to take questions.
Thank you very much, and Governor, thank you very much for your leadership during these very stressful times. I want to start as well by echoing my appreciation for those who have voluntarily complied so far. We know that essential services will continue, and we know that workers need to be able to commute back and forth from work. Everyone is still able to travel for their basic needs like food, medical assistance, and gas, but we're asking the community to be judicious in their permissible travels as well. The quicker that we can nip this virus in the bud, the quicker we can start relaxing the requirements, and we still have a ways to go. Our officers are working 24 hours a day, 7 days a week to keep our community safe. We're focusing on businesses, both closed and open, to provide a reassuring presence and to deter criminal activity. Please don't confuse our requests for voluntary compliance as optional compliance. Your voluntary compliance will allow law enforcement to focus our efforts on crime prevention and community safety. And I'm confident if we all stick together as a community, we will get through these unprecedented times stronger and closer than we have ever been. And Chief Miley.
Craig, I would echo your words. I really wouldn't add much to it, other than to say, Governor, on behalf of the chiefs, I want to thank you for your leadership with this. These are unprecedented times, and I know you're trying to look out for everyone, to include the firefighters and police officers that are out there to protect and serve. And I would also like to take this opportunity, Chief Batiste, again, on behalf of all of us, our condolences and our prayers are with the state police and, of course, the troopers' family. With that, I think both Craig and I are available to answer any questions.
Chief, you just made me think of something talking about leadership. The one thing that I continually am impressed by is the fact of how many Washingtonians are being leaders in their own right. Family members, business owners, pastors, people are stepping up. And this is a moment where we can all be leaders. And if we do that, we're going to get through this. With that, happy to stand for questions.
So we're going to start with Rachel from AP.
Governor, with the president now saying that national social distancing guidelines will need to remain in place through the end of April, and you clearly indicating that our stay-at-home order will ultimately need to be extended, why wait to do that? And do you anticipate that it will need to be in place through the end of April or longer? And then also a quick question for Chief Batiste, if there's any data yet on how many warnings or group disbursements have had to happen this past week.
Do you want to answer that first, Chief?
This is Chief Batiste. I don't have any data related to that. I don't know if any of my peers on the phone have any data related to her question. So if you do, please help me out here.
What is the department's?
I couldn't understand you.
Could you repeat that, please?
Go ahead, Gov.
We'll get that data.
As I've said, we look at the data every single day, sometimes hourly, and we have extensive data about the positive rates of infections. We have extensive data about the hospitalizations on a daily basis of COVID-like hospitalizations. We have extensive data on traffic to indicate as a proxy how many interactions people are having, and obviously we have the infection globally in the state and our fatality rate. So we look at those things on a daily basis and try to make decisions based on that data rather than some doctrinaire approach. So we have not made a firm decision on this as to what will be the next steps after this 2-week period. But I can tell you from the data we have today, it is very highly likely that there will be some further measures that are associated with stay home, stay healthy. And the reason for that is that while we may have had some success in some parts of our state, to some degree, a modest degree, bending the curve down of the rate of acceleration of the virus, we have some disturbing news in other places in the state. We just looked at yesterday's percentage of tests that were positive for COVID-19, and there's some very disturbing numbers in that. I'll just mention some of them. In Skagit County, 21% of all the tests came back positive for COVID-19 yesterday or the day before yesterday. In Adams County, it was 19%. In Island County, it was 17%. In Benton County, it was 16%. In Franklin, it was 15%. These numbers are 2 to 3 times higher than what we've experienced in the week or two before. So it is very alarming to us, frankly, and indicates that we have to refocus our attention, redouble our efforts, and stay on top of this effort. So we don't know what the duration, if that decision was made. Now, that decision has not been made yet, but if that decision is made, we will look at the data, we will listen to the epidemiologists, we'll talk to the world's experts, decide what might be necessary. But I do believe we need to do what's necessary so that we can get ahead of this and not have this drag on for years. So that's how we will be thinking about this issue.
Next, we're going to go to Keith with Coma.
Governor, what are you talking about? Mainly cracking down on businesses rather than having officers driving around and arresting people out on the street in their cars, that kind of thing.
I think the question is, why are we focusing on businesses rather than stopping cars? Well, it's still legal to drive a car in the state of Washington, and so there's not a reason for pulling over drivers. There is a reason for pulling over people who, might be want to sell hot tubs that aren't necessarily an essential business. And for those businesses that are not essential, it is illegal to be in operation right now to endanger human health, and that's where we can take action. But I will comment on this issue of driving. While we've had some success in reducing what you might think of non-essential trips, we do not believe that we've had as much compliance on that as we need. We think we might have reduced the trips by perhaps 50%, and that's a round number. We haven't done the full analysis yet. And we need more people to really stay home and not go out when it's not necessary. And frankly, there's just too many folks still doing that. And we need people to make individual decisions. One of the things I said the other day, and I actually believe it, maybe not a bad idea to tape a photograph of a nurse who puts his or her life in jeopardy when they go into these environments sometimes on the dashboard of your car, and really say, is this trip really necessary? Because when you do go out, to some degree, you're exposing yourself either as a transmitter or a potential victim. So we will be looking at those numbers in the upcoming days to decide what is the next step.
Now we go to Joe with the Seattle Times.
Governor, you mentioned that the state's gotten thousands of calls of people alleging that people or businesses aren't violating these orders. Can you give some more detail on what sort of calls you're getting? Is it particular types of businesses, is it particular parts around the state?
I can't give you that, Joe. If there's any summary of it, I'll try to provide it to you. I don't have particular information about that. I'll try to send you any information that we can. I'll get that to you.
Now we're going to go to Jim with the News Tribune.
Yes, I have a question for the Attorney General, which is, you had mentioned the landlords getting creative. I was wondering if you could also quantify that and how they're getting creative and what the state would do if individual tenants are at risk of being evicted.
Sure, I think I can most easily answer the second part of your question, if that's okay, and that is if someone is being evicted or faces the potential for eviction in a way that violates the governor's order, then yes, we are looking at those very seriously. We'd be contacting the landlord, of course, and doing what we can to assist the individual in that situation. So to be clear, we cannot have folks being evicted while this moratorium's in place. That's bad for everybody's health, reinforcing the governor's points already, and putting them in a challenging situation, to put it mildly. So in terms of what we've seen, there has been, my team has mentioned, as I mentioned, some creative ways, trying to essentially change the terms of the agreement, adding certain charges which, if not paid in a certain way, hey, it's not for lack of paying the rent, for example, it may be something else, okay, that they're getting after. And look, we want to be clear, the intent of the governor's proclamation is going to be enforced. We think this is critically important. We encourage Washingtonians to continue writing to my office, and we can assure them if they write to our office, we'll be following up on all those complaints and making sure that the letter and the intent of the governor's order and moratorium is enforced. Thanks for that question.
Now we're going to go to Austin Jenkins with Northwest News Network.
Governor, this is Austin Jenkins. Two questions. What beyond the stay home, stay healthy order can you tell the public about how long this lack of normalcy might last? Are schools going to be out for the rest of the year? Are we looking to midsummer at the earliest to maybe start to feel some sense of normalcy? And then can you also tell us how Bill Gates and Elon Musk might be able to help the state and what you talked to President Joe Biden about last week?
Yes, first off, I would very much like to be able to tell Washingtonians when we will have defeated this virus and when we can restore our games and our schools and everything else. I cannot do that. No one can do that today, at least if you're exercising decision-making based on data, because the data continues to come in and change over the days. As I've indicated in the last few days, there has been some additional data come in that is not as confidence building as we would like. So as much as I would like to tell you that, that is in the realm of knowing this. We're going to make good decisions. We're going to make a decision to return to normal when it's healthy to return to normal, and when we've done enough, so we've either eliminated or, to the extent possible, the prospects of this virus coming back. And the debate is going to be, as we go forward on this with some of our stay home, stay healthy initiatives, is when do we get to the point where we make sure it doesn't come back? And that would be unacceptable to us to win a victory in the second half and then lose in the second half, or win a victory in the first half and then lose in the second half. So all of those decisions will be made when we have the data to give us confidence in making those decisions. And I want to tell people that I have an understanding of the uncertainty and how difficult that is in our lives. I have 3 grandchildren in public school. They want to know when they're going back, as does their mother and father. Certainly the small businesses that have been impacted by this, and this is a huge hardship on these businesses that employ people and sometimes have started a dream business. These are friends of mine, and it's very personal. So I want to tell you, I understand that uncertainty. We're going to do the best we can to answer the questions just as soon as we can. You had a question about my discussion with Bill Gates, Elon Musk, very productive discussions. Elon Musk has offered to help to see if in his supply chain there might be places to obtain some necessary medical equipment, particularly ventilators, which obviously we have a keen interest in. And he's been able to help another state or two, and he's indicated that he will try to help to see if there's a way to help for access to them. He also was very useful in thinking through our policies, and he and I very much share the view that the more we have a unified response to this as one nation rather than 50 states competing for these products would be very, very beneficial. For instance, even if we could share ventilators from state to state, and if we had federal guidance in that regard, it'd be very, very helpful. I'm hopeful that that will happen from the federal government so that we can have a more coordinated national response and put these assets where they can do the most good. So I really enjoyed talking with him. Bill Gates has been super in understanding the need for testing, and we had some ideas about how to maximize that. Together with the fund that he has funded for research, we're so lucky in Washington because we've had this research project for the flu and other viruses that now has morphed into providing some of the world's best research is going on because of Bill and Melinda's efforts and great researchers. So they've been very helpful. I talked to the Vice President this morning, and we talked about a couple of needs that I am hopeful that he can be helpful with to increase some of the critical supplies we need, and he indicated he would try to see if he could be helpful in that regard. So I appreciated his call. We're having good communication with our federal partners. I've spoken to the director of FEMA, the Undersecretary of Health in the last 2 or 3 days, and those conversations will continue. We're very appreciative of the Army that's now in Washington, the 627th from Fort Carson, and the Army Corps of Engineers is very active right now. So we're having good communication with our federal partners. There are some things that we are very hopeful that are going to be in the offing because they are necessary. We still have critical needs in the surge capacity of our hospitals. We have critical needs for personal protective equipment. We have nurses and doctors right now who are struggling to get access to our personal protective equipment. And we are trying to build that supply chain not only through the federal government, and we have got masks and the like from the federal stockpile, but we are also pursuing our own system of ordering material anywhere we can find it in the world today. And we're being as aggressive as possible in that regard. And was there anything packed into your multi-part question?
Chief Millett actually had something to add to that.
Yeah, Chief, go ahead.
Thank you, Governor. Over the last several weeks, we've been getting calls about people congregating in violation of the state mandate. The King County Police Chiefs and Sheriffs Association had a meeting last week, and we talked about our approach to how we're going to be managing and handling these situations. And before I get into that, I again want to echo the governor's comments about please don't call 911. 911 is an emergency center, emergency lines, and we need to keep those lines open for the I need you here now calls, the emergencies. That being said, in King County, and I'm sure it's throughout the state, our posture is this: when we receive this information, our role is to inform and educate. We inform people that gathering together is actually placing themselves, their loved ones, in harm's way. And then we're educating and bringing to their attention that that particular gathering is actually a violation of law. We're not arresting people, we're not citing people, we're not detaining people. Our posture, our role at this time anyway, is to inform and educate. And as much as you possibly can, please don't report these incidents on the 911 lines. So thank you for letting me add that, Governor.
Thanks, Chief. Glad you're on the call.
Next, we're going to go to Essex with Kyra.
Yes, Governor, we have all watched as the president has mentioned your name with some animosity. Is there any evidence that the president's feelings about you are affecting the help we get here in Washington State? For example, why do we still have PPE shortages after all this time?
Well, everybody in the United States today, every governor, Republican and Democrat, has a shortage of personal protective equipment. It is a problem we all share, every citizen shares across the country. So that is not unique to us. We actually have had hundreds of thousands of shipments from the federal stockpile to our state that are today throughout our system of our hospitals. So we have received assistance from the federal government. There are some things that we are very hopeful that the federal government can help us with, and I talked to the Vice President about a couple of those things today, and I'm very hopeful that they can improve. What I can tell you that I think we have good open communications, as indicative that I talked to the Vice President today, and and had a professional and discussion. So that's good. But look, we're going to need a lot more help from the federal government before we're out of the woods. And I've made that very, very clear to the Vice President, and there's good evidence to back that up. So it is appropriate for us to make sure that we let our federal partners know what's needed. And it is needed here. And again, I'll just come back to this issue. One of the repeating questions is, when are we going to be able to, have the end of this game? And again, I would point out, we cannot say, because we want to make decisions based on data. And some of the data that the federal government was working on is a little bit antiquated, because now we've had, as I've said, sort of a spike in positive tests in a variety of places in our state. That's going to up, or should up, the commitment of the federal government to help us on hospital beds, on ventilators, and a host of other medical equipment. So we make sure that they know about that on a daily basis, and that's one of the things I talked to the Vice President Pence about. One other comment, if I can. One of the really hard things about this disease is you don't know what it's going to do to you until 2 weeks after you either took a good action or you took a bad action. And so the results are 2 weeks before we really know or after we take an action. And what we're seeing is, in some of the areas in the state that have not had many fatalities yet, people have just not seen the mortality associated with this enough to really be committed to follow this order, frankly, and hunker down. So we're seeing some more compliance in the central Puget County core area, where people have seen their neighbors die. In some other places in the state, they haven't really seen a lot of that yet, but it is coming. It is coming, and people need to understand that. What has happened at Evergreen Hospital in Seattle is coming to the Tri-Cities, in Moses Lake, in Port Angeles, in Vancouver, and it's already there. So again, it's why we're here today, to encourage people to be uniform and being part of this team so we can get through this together.
Next, we're going to go to Jim with the spokesman review.
Thank you, Governor. In Spokane, they were told today that there were only 3,000 test kits available across the state as of state kits, for commercial ones. Is that still the case? And if so, when can we expect that to change? And since we have Chief Meidel on the phone, I'm wondering if he could detail what sorts of gatherings or businesses his officers have been in contact with, trying to get them to comply with the order.
Chief, you want to answer that?
Sure, absolutely. Thank you very much, Governor. So, I'm not going to go into specific details about which businesses, but I will say that we have set up a website as well as a phone number here locally for folks who want to call in and complain about a business that is open and should not be. It's not an essential business. We also are asking our community to use this same website, which you can find on our website, as well as the phone number for those complaints. Make sure that you leave Crime Check and 911 open as well. We do have a format in place. We're working with the Regional Health District on those businesses that are violating. Again, our first priority is education. We don't want to have to go the enforcement route. If we do find ourselves having to go that direction, we're going to work closely hand in hand with the Regional Health District on that process as well.
On the test kits, good news and bad news. The good news is that we have, because we have been as aggressive as possible in first standing up the Washington State Crime Lab that has tripled its production of being able to analyze these tests, because we're lucky to have the University of Washington capability, which has tripled or gone up by a factor of 5 or 6, we've been able to have probably about the second highest testing in the United States per capita the last time I checked. That's the good news. The bad news is we are way, way, way short in our testing capability, as is every state in the United States. And so we have been working on two parts of this. One, what you might call the back end, which is the ability for the laboratory to take the sample and test it. That is going up dramatically. We're in the 5,000 or 6,000 range, I think, a test today now. I'll have to get you the number. Yeah, we're in about the 5,000 or 6,000 tests a day range. That's gone up by a figure of, probably 20 since a month ago. So we've been quite successful building the analysis part. But now we got a choke point on the test kits themselves. That's the swab and the vial medium that you have to preserve the test in, and plastic bags to send it to the lab. And we do not have that equipment. And it is so dire that our State Department of Health had a fella drive from Seattle to Spokane last week, I think it was Friday night, to pick up 40 test kits and deliver them to Yakima where there's an outbreak. That's how both dire and dedicated we are to try to solve this problem. So the way to solve this problem is twofold. Number one, manufacture, to the extent humanly possible, this material that we use in the kit. And frankly, this is one of the places where the federal government could really, really help out. And you may have heard me talk about this before, but it's so important, I want to reiterate it. We need a federal mobilization of the manufacturing capability of the United States to make these test kits. And we certainly have that capability, but we have not mobilized the companies that have the ability to do this yet. This could really use a federal leadership to get this job done, so that any place in the United States where there's a company that can make these test kits should be making those test kits today. Now, the federal government, through an order of the president, has the ability to require that. Following my urging that the president do that last week, the next day he did that for ventilators. And that was a good decision. We were gratified by that decision. And now a Bothell company, Ventec, is now going to make these with General Motors. They were probably going to do it anyway in this particular case. But we need a federal mobilization to make these test kits and to make masks and to make gowns and to make visors. And we can really use that. Now, we're not waiting. We're doing this in our own state. I talked to Dan Nordstrom, who's the CEO of Outdoor Research. They now are going to start making masks and gowns in the 100,000 per day area region. Our prison industries are now making surgical gowns and the like, but we have yet at the moment to have found a local manufacturer to make these test kits. And we're going to work doggedly. I met this morning with my team at the Department of Commerce and our emergency command center that are working to try to find local manufacturers. Now, the other good news, as you know, is that there has been approved an on-site testing system so that you can take this kind of box equipment to a site like a nursing home and collect those samples and get answers of positive or negative in something like 45 minutes. That technology is coming on, and the Vice President in a call today indicated that those are coming to our state fairly shortly, at least some of these.
We have time for a few more questions. We're going to go to Megan Carroll with Crown.
Hi, Governor Inslee. We have heard some rumors over here in Spokane that it's possible that we could be getting a field hospital of sorts as our cases increase in the area. I saw today that but has the state been looking at any sites in Spokane as the number of positive tests increases in Eastern Washington?
I don't know the answer to that. I'll try to get you any information I can. I know the Army Corps of Engineers has been looking at several sites. I think, to my knowledge, those are on the west side at the moment. I don't know if they're looking at sites today in the Spokane area or not. I'll try to get you information I can in this regard. Listen, we think over time our hospital system is going to be stretched all across the state of Washington, because that wave right now is closest to the Puget Sound Corps, but it's headed to Spokane. It's headed to Walla Walla. And so we want to be prepared for the expansion of our hospital system. It's one of the reasons why I ordered elective surgery to be shut down, so that we could stockpile personal protection equipment in Spokane so it will be ready when the wave hits Spokane. It's why we're looking for ways to get additional beds that can be distributed across the state And we have, I think it's 1,200 beds that have already been delivered, the actual beds themselves. And our hospitals can increase their capacity. It's why we've been very aggressive in moving patients who really don't need to be in a hospital into other care settings that can be healthy for them and free up space in the hospital. We've moved about 380 of those patients. So we believe there's going to be a need for surge capacity in every region of the state of Washington. And so we're planning for every region of the state of Washington to have that surge capacity as much as humanly possible.
Next is Simone with Q13.
Governor Stephen Rosario here. I want to for neighbors about stay at home. I find in my own neighborhood, people seem to be a little confused. Some people are still getting in cars and feeling like if they can walk on another trail somewhere else, that as long as they're staying away from people, they're still abiding by social distancing. Is that accurate, or do you have a specific warning so people can really understand the seriousness behind what this really means on our day-to-day lives?
Yeah, and by the way, the uncertainty about this, I realize this is a challenge for families, and to some degree, we've got to just sort of depend on the common sense and the good judgment of families. And I will just say, I think that the way we should look about this, when we go outside, we should think about, first off, that can be very healthy and a really good thing. I go for a walk almost every single day, and when I do, I just make sure to stay away from people, and I don't go where there's a crowd. I don't go where there's a bunch of people. Trudy and I went on a beach the other day, and she saw 4 people down on the beach to the east, and she saw nobody on the west, and we went west. And we would have never got within 100 yards of them, but that's the kind of thinking that we all need to embrace. Now, can a person go into a car to a lonely trail? I suppose that might be okay, but we really discourage unnecessary driving outside of your immediate area. You ought to be able to find a place, fairly close to walk, because when you do those trips, you're stopping at the gas station, you're buying a donut somewhere, you're having more interaction that's really not necessary. And we have had a problem where people have just swamped the little communities. The Grays Harbor was just swamped the other day. They're asking people not to stay away just for a while. So stay close and just be really rigorous staying away from people as much as humanly possible. I'll make this comment. We are victims of 10,000 generations of social conditioning. It is really hard for people not to stand within 2 feet of each other, because we have had a training in our culture that the social distance we accept is about 2 people. If I was going to go up to the chief and talk to him from this distance, he would think I was kind of weird. And so I have had people continue. I'll give you an example. We were setting up the Army Field Hospital at Century League Field, and I probably had half a dozen people come up and want to shake my hand. And we were down there setting up a hospital so that people won't have to get, lose their lives. So this is really hard, and we got to help each other, and we got to be rigorous, and we got to adopt a whole new way of doing business. And we can all be, as I said, we can all be leaders on that. You see somebody within 2 feet, hey, Jack, back up. And that's what's going to win this thing, is individual Washingtonians being leaders like that.
Next is Jerry with the Everett Herald.
Governor, this question, I guess, is for you and some law enforcement. We've been talking about enforcement for a few days now in our communities, but at some point, the threat of a citation, arrest, jail, prosecution is no good unless someone is cited, arrested, jailed, or prosecuted. So I wondered where the line is for you, for law enforcement. Is it 2 warnings? Is it 3 warnings? Where is the line that people will cross? And Bellevue, Chief, I wonder if you might talk. I saw a few days ago, you guys use it to gatherings, I understand, and I'm wondering if that's being used for enforcement purposes.
Hey Jerry, could you repeat the question for the Bellevue chief? You cut out for a second.
Oh, okay. I just want to understand the Bellevue use of a heat map of social gatherings. I saw a press release and I wondered if that's based on a tip line or if law enforcement's doing that on their own to search out and break up and disperse gatherings. So.
Do you want to add something, Chief? Do you want to say something?
That was for your Bellevue. In order for us to relieve the potential pressure on the 911 system, we came up with a tool for the public to report incidents as they deem necessary. We're not tracking information, we're not taking down names, we're not arresting people, we're not citing people, we're not detaining people. All this is being used for is for the public to be able to report something they want to report. And then as our officers become available in between higher priority calls, we will go over there. And again, our role is to inform and educate. And that's what we're doing.
Chief, did you have anything to add?
No, I just add, Jared, it's Chief Petit, State Patrol. You know, the biggest problem is businesses and our need for them to comply because they're the ones who attract others to their place of business. So we need their strict compliance. And when it comes to individuals, if you get repeated calls associated with people flaunting the obligation to comply, then that's when we're going to start looking to step up and take some necessary action, be it through regulatory, be it through citations or other means. But the last thing we want to do is have to arrest someone, to actually have to put someone, place someone in custody and arrest them. That is the last thing we want to have to do. So we need people to step up and do the right thing, not only in their best interest, but in the best interest of their family and others.
Last question with Drew with King 5.
Governor, today starts the week where 1 million students in the state are supposed to start their remote learning. Some districts have interactive back and forth over the internet, but there are districts that have students who don't have the ability, don't have Wi-Fi at their homes, and are getting their homework delivered with their free meals once a week. How concerned are you that the whole issue with equity is just not feasible under this once in a generation, once in a lifetime predicament?
Well, we want to make it once in a lifetime. That's why we're dedicated to beating this virus, and that means for some period of time not being in a school environment. We want to make it a once in a lifetime event. And because of that, the best way to do that is to go through these difficult times for our students and our parents and our educators. And it is difficult. There's so much uncertainty about the next several weeks, and I understand how frustrating that is to everyone. I guess what I would say is that we want to have equity in the sense that everybody ought to get the best possible education that we can possibly muster during this period of time. And there are going to be some differences between what, Walla Walla can do or Sela. But I just encourage everyone to be as helpful to our students as possible, and let's keep them healthy, and let's keep their parents and grandparents healthy too. That's what we ought to be dedicated to. Are we out of, I'm happy to take a few more if you're, do you have a few more or not? We're going to go a little longer if folks have more questions.
We'll go to Hannah with Cairo Radio.
Hi, Governor. Hannah Scott with Cairo Radio. Just wondering if the lack of testing ability that you were speaking to, how is that affecting our ability to really understand what's going on with the virus here in the state? And then a quick follow-up, any concern about if the weather starts to have more sunshine out and people then stop listening to your stay-home orders at that point?
Yeah, well, first off, let me, we're talking about getting the few holdouts on the team here, but we got to realize the vast majority, I don't know, 90% or something of Washingtonians are complying with this. They understand how important it is for their families. They do have a sense of fairness for their neighbors. So, we've had tremendous success in that degree for this order. I don't know whether I'm more worried about people deciding to start congregating again at the beach or hopeful that the sunshine will change the progress of this virus. As you know, there are some viruses that tend to dissipate as the humidity increases, and the humidity, I'm told, increases with temperature. So we're all hopeful that as the months progress, this virus would have some natural reduction. But again, that doesn't mean it won't come back in the fall. That's why we got to be so rigorous on this, together with the fact that nobody has the answer today about the progress, whether in fact that is a real possibility. On your first question, which I'm promptly forgetting here for a moment, remind me of your first question.
Oh, sorry. On the
Testing, yes, I'm sorry, testing.
We were behind, yeah.
Yes. So, yes, look at every governor in the United States wish they had a statistically significant, double-blind research about who has this disease and where they are today. That would help guide our decision-making about when to do these stay-home orders and how long to embrace them. It would be tremendous to have that kind of information. It would also be helpful to find the people who are infected so that we can get them isolated, and so we can choke off the disease that way. So there's two ways to stop social interactions. One is what you might call a blunt instrument, which is everyone has to remain isolated. Or if you had everyone tested, you could just isolate the people who are infected. That would be obviously much less disturbing, but we just do not have the testing capability to do that. So it's a big time hindrance to our efforts. But it is not a hindrance in the sense that we know what works. What works is to stay home. And there's no mystery about this. You don't need a test. You don't need a Nobel Peace Prize or a doctorate in biology. This is what works. And so we ought to do what we know works, uncomfortable as it is. And that's why we're taking this approach, and that's why we're building everything we can to build testing capability. Again, I want to reiterate, because it's so important to my state, we need the federal government to do for the testing equipment, the swabs, the vials, the preservation medium, the masks, the surgical gowns, the visors. We need the federal government to do what they did the other day for ventilators. That was a first step, but there are so many more steps we need the federal government to help us out so we can get these tests out in the field.
Next we have Paul with Bloomberg.
Yeah, hi, Governor. Paul Shakowski. Thanks for taking my question. As the state hospital established a crisis standard of care to address the anticipated shortage of crucial equipment like ventilators and the resultant necessity to triage access to such equipment and perhaps even to the hospital beds themselves.
Well, I know that the question was about when or has the state adopted a crisis of care standard. I don't believe the state has as a state standard, but discussions are ongoing in hospitals about how to apply in the event that that type of crisis care line is reached, so to speak. And we are concerned about that. That's, again, why we're so dedicated to building surge capacity in our hospitals today. The thought of that becoming necessary is beyond painful. So it is redouble our efforts to be ready. And I want to thank everybody for helping out to be ready. Look, I have a friend who needs some hip surgery right now, and she's in a lot of pain, and it would be great to get that done, but we've had to put some of these things on hold to get ready for these fatal diseases to be ready to treat people. So we got a lot of people on this team that are pulling together, and we hope that they will, to avoid this crisis of care situation.
One or two more questions. Next we'll go to with the Yakima Herald.
Oh, hello, Governor. This is Mai from the Yakima Herald. Thank you for answering my question. I have three questions. First of all, kind of following up on the comment from Krem, we have received word from Astria Health that they are in the process of working with the state on a field hospital. Can you speak to a kind of a plan for Central Washington, including Yakima at this point?
Well, we know that we have been looking at the Astria facility. It has some real assets, obviously having a good building, and I'm told at least some equipment. So it is under consideration. No, to my knowledge, no final decisions have been made about Astria or any other of the similar positions other than the hospital that's going on in CenturyLink Field. So both Vice Admiral Raquel Bono, who's leading our hospital coordination team, and the Army Corps of Engineers are evaluating several of these facilities right now. I don't believe any final decisions have been made. But I want to just say that in our thinking about hospital capacity, we're thinking about the whole state. There might be a way that Yakima can serve people, in the Seattle region when there's a real surge need in Seattle, or Seattle might be able to help surge capacity for Yakima as the wave, we hope, passes over Seattle and, might get to Yakima. So we're looking at this as a system to try to maximize those beds.
Okay, final question will go to Mike Baker.
She had 3 questions, I guess. This is Yakima, they get priority. Do you have another question, Yakima?
Oh, thank you. The other question I have is regarding, so I know that the conversation has been enforcement for businesses. There's been some concerns from various farm worker groups and actually the ag industry that farm workers are getting harassed by law enforcement when they're working. And there's actually been conversations in the ag industry that, you should have letters, even though I know that you guys have made it clear that you don't need a letter to say that you're essential and can work. So I just wanted to ask if there's any efforts to, I guess, emphasize that essential workers don't need these letters, don't need passes, because there are people that are saying you do need a pass because their workers are getting harassed for it.
Yeah, I'm going to let the chief respond here.
Yeah, this is Chief Petite, State Patrol. So for our folks in Yakima, we've actually used our Spanish-speaking trooper who has our El Protector program to go out and educate and talk to the Spanish-speaking community about this. There is no enforcement when it comes to that. We put that out all over Twitter. We work with Idaho State Police to make sure that both states are in collaboration in this effort when it comes to rumors about the border being closed at the state line. So we're trying to push education out there. We've had a couple of complaints about that. We've looked into those, and we've not been able to substantiate those.
It is very important to our farm workers' health, though, that they socially distance, because even if you are working in an essential business, we still need people to be to socially distance themselves and not come within 6 feet of other people, just to the extent humanly possible. So that's good advice for everybody, and I hope folks follow it. Let's go to another questioner here.
Last question, it'll be Mike with the New York Times.
Yeah, hey, Governor, just ripping up the questions about test kits. I understand the president conveyed to you and the other governors today that there were no issues, or he hadn't heard no concerns about the test kits for weeks. The concerns that you're describing here, have you conveyed those to the federal government? What way have you done that?
I'm just thinking for a moment how to answer that question. It would be shocking to me that if anyone who has had access to any newspaper, radio, social networks, or any other communication would not be knowledgeable about the need for test kits. And I can be assured that the White House knows very well about this desperate need for test kits. Now, my understanding is the president did say that today, and I was shocked when I heard him say that, and I'm sorry to say that. But I can tell you that every single governor in this United States understands the importance and the fact that we are way behind the curve on test kits. So I'm hopeful that the president will take a look at this issue and be helpful. I want to reiterate this too. We have had help from the White House. Mike Pence has been very communicative with me and was as late as this morning. He has attempted to clear out some sort of regulatory underbrush that has been helpful to us. He helped us, for instance, when we had to get a federal regulation removed for for some of the early testing that prohibited us from doing some of the tests that we needed to do, and he helped accomplish that. That was helpful. So I just want to reiterate, there are things that we appreciate that the administration has done, but we got some work to do in this regard. Thank you very much.
And David Postman, Chief of Staff, will be available for audio-only questions right after this briefing. So thank you to the police chiefs on the phone as well.
I'm sorry?
Can I ask you a quick question?
We're going to keep audio going. The visual will be off, but we'll be